Hello, everyone, and welcome to today's partner webinar, Driving Performance with Analytic Reporting. My name is Ellen Knowles. I am the Marketing Communications Manager here at Azalea Health and will serve as your moderator for today's presentation. Before we get started, I'd like to go over a few items so you know how to participate in today's event. Everyone on this call is listening and using their computer audio system by default. If you would prefer to join over the phone, just select telephone in the audio pane on the right-hand side of your screen and the dial-in information will be displayed. You will have the opportunity to submit questions by typing your questions into the question pane of the control panel. You may send in your questions at any time during this webinar. We will collect these and, time permitting at the end, address them during the Q&A session. Also, please note that Jose's slides will be shared in a follow-up email after this presentation in case you want to review again or share with any peers. And I would now like to introduce Jose Valero, Executive Business Analyst at DashboardMD. Jose is a computer science and mathematics graduate from Florida State University. He began his career as a software engineer specializing in healthcare management software solutions, and has over 20 years of experience in working with practices of all sizes and specialties, including large medical groups, medical billing services, MSOs, and health delivery networks. Mr. Valero was the founder and CEO of a TM EMR software company in the late 90s, which was acquired in 2005 by Visionary Health Systems. Recently, Mr. Valero has been focused on data warehousing, integrating clinical, financial, and operational data for a large number of varied organizations to effectively implement enterprise performance management reporting solutions. So with that, let me turn today's presentation over to you, Jose.
Well, thank you very much for that great introduction, Ellen. I really appreciate it. All right, welcome everybody and good afternoon. I'm going to go pretty quickly through a couple of slides here to give you sort of a highlight of what we're really focused on. And one of the things that I really want to talk about today, and I want you to at least walk away with this sort of concept, is performance management. And I'm going to go pretty quick. I know we're short on time and we got a lot to cover. Little background about the company and what we do, and back to that performance management concept. So we really look at managing performance throughout a practice at all phases of the revenue cycle. We've been doing this for over 10 years now, quite a while. We do work with a lot of practices of all shapes and sizes and specialties, from small single docs, small groups, to medium and large practices, to even larger entities like large delivery networks rolling up multiple systems, and large academic facilities and OEM type clients with billing services and the like. And one thing that's really interesting across the board is the inability to really get sort of analysis data straight out of any practice management or EMR system. Azalea happens to be one of the more powerful systems with regards to reporting, and particularly with operational and day-to-day reporting. And these analytic systems really bring another layer of reporting focused on performance. And what we do is really roll up a data warehouse, not to get very technical, but the idea is to crunch numbers that you can see patterns that emerge in the form of trends and comparisons, really, to bring it all down to earth. I don't want to sound too techy. You might want to look at things like, I want to look at new patient activity and how it's shifting over time, and how does it actually affect me? How much do I get paid per new patient on average for these three payers? Those are great questions, and we're going to talk about those types of questions. But I want you to really think about how you're managing performance in the practice. And some of this stuff seems a little complicated in terms of gathering the data, but some of it's not that complicated. You really have to start thinking in terms of goals, asking questions of the practice and of the performance therein, and how you want to track that performance over time? What do you want to compare to? So let's bring up a couple things that at least some of us can relate to. I'm sure a few of these, like where are the new patients coming from? What are my referral sources, my top referral sources, and are they shifting? And are the payer mix? This is another good question for your top referral sources shifting, because you may be getting as many new patients as you did in the past, but perhaps they're sending you more Medicaid patients or something similar. Is the payer mix shifting overall? Maybe you know your top payers, but wait a minute, is this shifting, and how's it affecting you? Is it shifting in your favor, right? You all are, I'm sure, familiar with E&M coding levels, but how do you compare to national norms? You may be pleasantly surprised or unpleasantly surprised to hear that you're undercoding and leaving money at the table. I see that a lot. In fact, these days I see more undercoding than overcoding. Generic questions about AR. How much AR is left to collect from last month or from last May? For this payer or that payer? What physicians are working harder? How about some real generic questions? I'm not even sure how to start with that one. Do we have a problem with no-shows? I don't know. Let's compare that. No-show rates, average rates should be under 5%, across the country. But you may be in a different area, and so we can take a deeper dive in that. Has it shifted over the last year? Has it shifted in the last 6 months? And then, a nice super generic question, how are we doing this month? Well, I don't know. It feels like a pretty good month so far, but you got to have a comparative. You got to compare your results on a regular basis. So we do it in 3 ways. We have ad hoc analysis, which is on the fly to address some of these questions. We have hard copy dashboard reports that can be emailed on a regular basis to keep an eye on things. And we also have interactive dashboards for you to log in and monitor anytime. But a lot of this, albeit manual and potentially error prone, right? But some of this stuff you can do, and maybe you don't do it daily and maybe not even monthly, but every couple of months you might want to stop, take a breather, check where you're at, and compare to that same comparative goal. So on the ad hoc side of things, if you're thinking about new patients and top referral sources, you might start by breaking out a report by E&M visits and just carving out new patients by payers and where are they coming from. Then you might carve out your new patients by zip code. Maybe, if you're thinking of where they're coming from geographically, you might break out new patients by referring physician. And how's that shifting year over year? Here's a nice chart looking at last year to date versus current year to date. And you can see that one of my top referral sources had a big decrease. This is the variance, if you will. A couple of them had a slight increase, and a few here had a significant enough decrease. I'd like to dig a little deeper, and that's the point, right? On another front, you may want to define some specific performance tracks that you are measuring and are really keeping an eye on. Are monitoring is the term. So things like payer mix shift or E&M coding levels, you want to continue to monitor those. Perhaps you're even engaged in an improvement activity or an improvement initiative. Again, it's something you want to keep an eye on a regular basis. Here's an example of a nice, clean scorecard format for a report. This one in particular shows a lot of the traditional metrics for productivity, like gross charges, new patients, number of patients seen, RVUs, even visits per day worked, averages, see if that's shifting. You might consider looking at some of those ratios. Certainly look at scheduling analytics or cancellation rates, no-shows, and even some clinical quality where applicable. On the payer mix side, it's not always important just to know who your biggest payers are. As I mentioned before, a shift in payer mix might have significant effects, both negatively, unfortunately, or positively. You may want to look at average payments per visit or average payments per patient or even payments per work RVU if you have some RVU numbers that you can throw in there. And you want to look at how that's shifting over time and which payers pay you the most per visit on average and what are your top visits. And if a payer is shrinking or growing, you might want to quantify how that's going to affect you by the end of the year. On the AR side, you might want to keep an eye on what balance is still outstanding for a particular month, matched back to that month. This is a view of your total charges billed per month, separated by in a stacked bar. And each month is represented by what was paid in green, what was adjusted in yellow, and the red are pockets of AR that are still outstanding. And so these hard copy reports, along with maybe this E&M analysis, looking at current year to date versus prior year to date and the shift against CMS specialty benchmarks, are some good reports that can show you performance improvement or shortfalls with a comparable goal. And that is part of the key. The last piece of the puzzle is to be able to monitor these with some dashboards. Now, dashboards are really just reports that are focused on aggregate or analysis data, as opposed to raw data with a lot of subtotals and grand totals. It's sort of a summary screen, if you will. And so they don't have to necessarily be super complicated or really fancy. The point is to have some good, specific information, and preferably with a comparative, something that compares that number to what either you're striving for, a goal, or a benchmark, or maybe just good old-fashioned last month or this same month last year. Did we do better or not, and by how much? And so we've got lots of those. Obviously, that's who we are, and that's what we do. Here's a scheduling dashboard. I can show you some of these, time permitting, when we log into the site, and I can show you some of the live examples. Here's an E&M dashboard that you can slice and dice and carve out a few specific physicians, maybe a few time periods, and see if they shifted significantly. Maybe they're on their way to improving. And here's more of an executive view with, a little too many metrics here, but it's pretty, a lot of good colors. Typically, you're only going to need to look at 5, 6, maybe even 10 measures. But the point is to have measures that you track, key performance indicators, KPIs, and have them compared to a goal or a benchmark, and have that benchmark be specific over time, so that when you compare a trend and your trend's going up and down, you know how you're doing relative to that one point, that benchmark or goal. So hopefully that gets you thinking a little bit about some of your reports and how they may be, you may be able to improve on some of those. So I'm going to take a minute here to log into our application. The short version is it's a website. We do plug directly into the Azalea data. We pull it nightly, and we basically crunch all the numbers into a data warehouse for you. And what this enables you to do is log into this application. This is my home page. I've got some favorite dashboards, some favorite ad hoc reports that I've created. I've got a ton of popular reports I can access and stuff. And it's really designed with a very clean sort of user interface. You can log in with any browser, certainly with any mobile device, including phones. Not that you're going to do a ton of this on a phone, but you can run any report, and it's all available. I'll start with dashboards and work through ad hoc and maybe show you a couple reports at the end of that. So on the dashboard sides, we have lots of nice dashboards that you can look at. I'll pick this appointments dashboard. I think everybody can relate to. And it's a pretty easy one to digest. Let me clear my GoToMeeting panel here. There we go. And so what you're looking at is your total appointments per month broken out by, arrived, booked, bumped, canceled, and no-show. And you can see over here the data table of your total no-show count and the percentages therein. And down here you've got two analytic components. We can trend over time the shift of these appointment types. This is by a specific appointment types. That can be done by physician or location or even patients, or all sorts of different ways to slice and dice the data. And over here you've got the comparison. Right now it's looking at the last 12 months. Maybe I decide to shorten that time period. And I say, I want to look at the last 3 months versus the same time last year. And I can see that this doctor had a pretty significant decrease in arrived appointments, as well as this one. But This one, Dr. Hill had an increase in arrived appointments. So that might be a finding that I might want to look at or expected. And Dr. Leach here, one of my biggest producers, maybe he wasn't even available at that time period. I could also shift the view completely and look at no-shows or cancellations. See if there's been a bump up in cancellations accordingly. And sure enough, this doctor has a particular jump in cancellations, while this doctor had a drop in cancellations. And I would say this one's just got a slight change. I wouldn't even pursue that. But this might be a finding I might want to look at a little closer. And the way these systems work is they allow you to get a bird's eye view with the ability to slice and dice that info, and also have a performance view. So I'm going to run this scorecard. We've got lots of different flavors of scorecard dashboards. This is an enterprise sort of roll-up scorecard where you might consider looking at a group of docs rolled up, or perhaps a bunch of locations. And what you're going to find is you're going to sort of cherry pick your key indicators. You'll decide what you want to track. Again, as I said before, you don't have to look at 20 or 30. You might pick 4 or 5 that are particularly important. And what the system does is it shows you how you're performing month to date. It compares you to the last 30 days. It shows you your target, and then it projects for the month how you're expected to wind out the month. It looks at a year-to-date versus a prior year-to-date comparison as well. And then you can dive into a particular measure if you wanted to analyze it further. Once you're there, I have this broken out for these 2 different practices. I might dive into this particular practice that is showing a little bit light on the gross charges, and I might want to break that out by maybe payer, see if something stands out, like one of my biggest payers has had a recent drop in activity. And on this side, I can also do a comparison maybe by, I don't know, maybe my top CPT codes. If I wanted to get that granular, here's my top 5 CPT codes. And indeed, there was a bit of a drop here on level 3 visits. And this other code, I'm not sure what that code is. But maybe I'll roll it up to a little bit higher level, like a CPT section, which is more of a sort of a roll-up of our services, if you will, meaning E&M versus radiology or surgery in some instances. And indeed, we did have a significant drop in E&M visits. That may be, what I'm feeling here. But the idea is that you can track performance relative to a goal. And, this is this current month. I might go back to last month and see how that month sort of panned out and refresh it. You can go back in time. And as I was saying, being able to track performance versus goal, and I can have a nice, clear conversation with providers, let's say, for expectations of volumes, and have a clear communication throughout the organization of our corporate strategies and expectations. And that really is what it boils down to, is being able to clearly communicate what's expected, what the performance measure is, and how you're doing relative to your goal. Now, let me see, how am I doing on time? Pretty well, okay. So let me give you a little flavor of the ad hoc, because inevitably you're going to want to dive into that data a little further. And I can go in here and do just a quick one. I have enough time to show you how this works. The idea behind the ad hoc is for you to be able to build these on the fly. So let's just take something simple like gross charges, but maybe we wanted to carve out E&M visits or surgeries or a particular set of codes or something like that, or payments or actual payments per visit or something like that. All that's available. And you can parse that out by, let's say, financial class and maybe CPT code. Section. We'll get all sorts of breakouts by CPT code. That should work. And I'll pick data service. I'll keep it simple. I want to look at it monthly. And I'm going to use one of these nice little formulas here. Do year to date. Now you can cherry pick this information. I might want to look at August and compare it to May. I don't know why, but that might be something you need. You can mix and match this in all sorts of ways. You might want to carve out just E&M visits. For example, I might say, you know what, I want In fact, I want everything except E&M visits. I might do that, and that's perfectly acceptable. So there's lots of ways for you to look at this data. Once you get the results set, you could sort it by any column. You could sort it by any row. Basically here I'm going to have my top payers or my top financial classes rolled up to the top, and gross charges per month. I could see it as a chart. There's lots of nice charts that I can use, and all of this can be exported to Excel or PDF on the fly. And the real strength here is twofold. Number one, yeah, it'll allow you to build a very complex report very quickly. If you needed to know how much you got paid for February's billing for doctors A and B for these two codes, you can do that, literally click your way through it. But how about this scenario? What about when you're not even sure? You just want to look around. A number looks a little low or looks a little high. So you can come in here and cross-reference this information. I might drag and drop CPT section up here. Maybe I'll drill down on the particular payer. Maybe I'll drill down on a particular E&M section. So you have the ability to really hone in on the details here in all sorts of ways. And ultimately, I might want to identify this $18,000 worth of TRICARE for February, which might look a little suspect, and I want to double click on that, and I can drill down to the actual transactions and even identify the patients therein. So the big picture here is that I can be much more fluid with this data. I can ask more intense questions, and ultimately go from the 30,000 foot view to the 10,000 foot view here, including maybe identifying patients. And don't worry, this is all de-identified data. It's all real data, but it's all been through a post-run process that mixes all the patient names and all the PHI. But the nice resulting output here is that you can export this to Excel and have a nice, very clearly defined set of records. And indeed, you can even go a little further here because you've got a nice pivot table you can work on. If I wanted just new patients, I'd carve out the new patient visits, and here they are. So it gives you the ability to really go from that 30,000 foot view to the 10,000 foot view, and ultimately down to the ground floor, which is indeed the transactions, whether they're charges or payments or adjustments. Last but not least are the reports. So the reports, the idea is to automate some of your reporting where possible, and really implement a push model where reports get pushed out. Imagine being able to push out monthly reports to providers that detail their productivity, and they're automated. And not all reports are going to go out automatically, but there's sort of a layer of reports that should go out automatically that you would expect, and maybe even some reports might go out weekly to some folks, all of which can be set up. This is an enterprise sort of executive summary view. Gives you some totals per month, and it compares your running 12 months to your prior 12 months and sort of shows a growth rate. Here, I know this might be a little small there. Let me just zoom in there for you. So the idea is that it gives you, your totals for the 12-month average versus the prior 12-month average. And it looks at volumes and charges and collection rates, and it even looks at ending AR and your AR over 120 and the percentage therein, so you sort of get a feel for the trend. So all good stuff. The idea behind these reports is to be able to send those automatically. I took the time to run a few. Here's a scheduling analysis report that looks at your no-show rates, and it's got some charts and graphs on pages 2 and 3 of your schedule and the utilization therein. Are you at 100% utilization, at 88? Here's a provider productivity report with it's a real comprehensive one. This one has a scorecard out front, and then pages 2 start showing you year-over-year comparisons for payments and visits per day. You got a payer mix analysis and new patient analysis, comparative payer mix versus the practice, and even a breakdown or a roll-up of the types of services. This is a practice manager dashboard. This one gives you a little bit more of a financial view of the practice. Got a lot of metrics there, comparing the certain month versus the same month last year and your 6-month average. There's a little snapshot of your AR, and I'll just keep scrolling down. Here's your year-over-year comparatives on some payment ratios. Here's your top 20 CPT codes compared to the Medicare allowable, which you're getting paid on average, top 20 DIAG codes, and so on. And so to summarize, there's a lot of these summary reports that you can put together and tie them back to a performance. Notice that these reports had one thing in common. They tend to have some sort of a comparative, a measure, if you will. There's a goal. There's that green line. I need to have some sort of a comparative to tell me how we're performing according to our expectations. And in some cases, it's a indicator, green, red, or yellow, right? Blue to us means best practices. It's like a best practices benchmark to strive for. So I guess I got to wind it down with that and save us some room for some questions. Ellen, maybe I'll turn it back over to you and see if the folks have any questions I can answer.
All right. So thank you, Jose. We will start answering some questions that have been submitted during the presentation. It looks like actually we only have one question that was the same from a couple of attendees, and that was, how can we export into a CSV file? So if you did explain that, if you want to just maybe walk back through how to do that one more time. And then for other attendees, feel free to still submit questions at this time in the control panel.
Sure. So good question. I mean, all of these reports, fortunately, can be exported to a number of formats. So CSV is very common. We use pipe delimited because sometimes there's commas in the data, and that tends to mess things up. But you can do CSV, you can do PDF, good old-fashioned Excel. That's still, excellent. Even Word, if it makes sense, because you might be working on a presentation and you go from there to PowerPoint. If you're on the actual ad hoc, and I got that screen, you can export from there to PDF and Excel directly. And from Excel, of course, you can export to CSV or what have you. So a lot of flexibility with regards to exports. The point is to sort of build your analysis here and then maybe dump it to Excel or CSV, perhaps for further analysis or to make it part of a bigger model where you're bringing in data from even another system or something in that order. So good question. Now the interface with Azalea, just to mention, is fully automated. So it's not like you have to pull the data and export it and then put it in here and then build out your reports. This is really more of an environment. It's about as turnkey as these things get. We do pull all your historical data. And our goal really is not to just give you more reports for the sake of more reports. Our goal is to roll up our sleeves and work with you guys to define your performance improvement initiatives. Where do you want to improve? Maybe baseline and do some initial benchmarking assessments, and then say, here's where we want to improve, and set some goals, and then have a good monitoring tool where everybody everybody has access to that can have that can affect a positive change on that performance initiative.
All right, thank you, Jose. That is actually the end of our questions. So we are approaching the top of our time, so we will go ahead and conclude today's webinar. I do want to note that any other questions that may have not been submitted at this time, we can absolutely address following today's call. Thank you, Jose, and a special thank you for everyone taking the time to attend today's webinar, Driving Performance with Analytic Reporting. As a reminder, Jose's slides will be shared in a follow-up email, and we will also include a link to review the recording of the webinar in case you want to look at it again, share with any of your peers. So on behalf of Azalea Health and our presenter, thank you for joining us, and have a great rest of your day.
Thank you, Ellen. My pleasure. Thanks, everyone. Bye-bye.